My name is Blandine Augustin, and I am the Graduate Nursing Student Academy Liaison here at Marymount University. I am also a student in the Doctor of Nursing Practice program here at Marymount University. I'm here today with Dr. Rosemarie Berman, who I will be having a conversation with about nursing leadership, and many of her contributions. And so I just want to thank you for taking the time to have this conversation with me. Okay?
Good morning, Blandine. I'm really pleased and excited at having this opportunity to speak with you this morning. I've been here at Marymount University for the past 6 years. I'm an associate professor, and I currently chair the undergraduate Baccalaureate of Nursing program here at Marymount University. It's always exciting for me to see young nursing professionals as yourself who are willing to assume some of the leadership roles and activities that nursing as a profession so desperately needs these days.
Yeah.
So,
thank you. Well, I wanted to start the interview, just the conversation, I'll call it a conversation, with, you mentioned that you are the chairperson here at Marymount University and an associate professor. Could you tell us a little bit about how did that come to be? How did you end up at Marymount University?
I came to Marymount, as I mentioned, 6 years ago, after having quite a wide, varied background in nursing. I knew very early on in my career that I would probably go into nursing education and research. I had some wonderful mentors as an undergraduate student at Adelphi University, and then when I moved on to New York University for my master's and then my doctorate in nursing, I was really very, very lucky to work with some of the foremost nursing leaders there, who then kind of spurred me on in terms of my professional growth. I've always been heavily involved in nursing education from very early on, as well as keeping a clinical component for my work. When it was time for me, not unusual for many nursing professionals in my generation, many of us took some years off where they kept nursing and did what they wanted to do in terms of contributing to their field on a part-time basis. And then when the time was right, we moved forward perhaps with a stronger focus on our profession. I taught for many years in a number of different universities here in the DC metro area. And then when it became time for me to settle down, I chose Marymount. It just seemed as if it had the right combination of scholarship, research, focus on nursing education that was the right fit for me.
Oh, good. And you say you've taught many classes, many courses. What would you say is your favorite course, or what course do you tend to teach the most?
Once again, my background has been quite different. At one point, I feel as if I have taught actually in every possible over the years nursing program, from nurses' aides, diplomas, LPN, associate degree nurses, and baccalaureate nurses, with a focus spanning from med-surg to maternal child health, which I then assumed that as my focus probably about 25, almost 30 years ago. So nice. I've been here for a long time.
Nice.
And at one point I switched into maternal child health, primarily because I've always had, even when my other areas were focused, I always had focus on family theory. I'm a strong proponent of looking at the patient not only as an individual but also as a member of the family and society, and I believed I could have my greatest impact there. That being said, I love teaching maternal child health. I enjoy the variety of being able to teach nursing research, a professional foundations course. undergraduate research, graduate research, and the capstone class, which I consider our send-off for our undergraduate baccalaureate prepared nursing, where we synthesize and put everything together before we move them out into the real world of nursing as it is today. So I have some favorites, but the students would laugh at me because I begin every semester saying this is one of my favorite courses to teach. So I hope I'm never asked to choose to only teach one area.
Okay, good. Good. So definitely a lot of research I hear,
yes.
With the focus on maternal child health.
Mm-hmm.
What would you say, as far as your research in maternal child health, what are some of the gaps that maybe this research has covered? I know you said looking at, the patient, the person as a whole and their family. What would you say are some of the gaps that your research has covered?
Well, there's quite a few gaps.
Okay.
And even though nursing research has made such progress over the years, we still literally only have drops in the bucket, just a little bit. My area, again, has to do with family. So my dissertation research, my doctoral research, was on the transition of first-time parenthood. I got into that area for a number of different reasons, and then I taught childbirth education classes for a number of years to coincide with that. So that really led me to, that leads me to believe that we really don't have enough information yet, enough research, enough evidence to support what we're doing with young families as we help them make that transition. We tend to focus a lot on labor and delivery when that's only a very small portion of being a parent. That's only 24 hours, which then begins a lifetime, you might say, a lifetime of parenthood. And certainly the role of the nurse I would love to see expanded in that area with what we do as being evidence. With that, I've done some work on breastfeeding. I've also done some research on prenatal education, again, looking at some of the barriers and learning needs of minority women. And then most recently, as I've been in education for the past 5 years, I've kept that on one side of the table, and then the other side of the table, I'm really interested in doing some research on nursing education and how we can best prepare our young nurses today for assuming the roles similar to what it is that you're looking forward to doing. So again, kind of wide and varied. I have 2 different areas on the table, and I'd like to continue with both.
Oh, well, good. You mentioned like a lack of knowledge and a lot of like just prenatal education, prenatal care. How do you feel this relates to just creating policies? If you could even connect the two. I mean, there's always a way to connect it. But
there are a lot of ways to connect it.
Yeah.
And there are a lot of different policies that I think we as a nation need to address in terms of caring for young families and giving them the things that they need to promote healthy, mature children, young adults who can then contribute to their community. There are still many areas, in the past 10 years, I guess perhaps even a little bit more than that, we've developed some policies in terms of breastfeeding. We know that breastfeeding has a major impact on both the mother's and the child's and the infant's health during that first year. And we still have, and we do have some excellent legislation about that. There's been some policies made. They need to now be followed through and implemented in the workplace so that women can actually continue with being concerned with their health, their child's health. There's a lot of issues in terms of child care, so that women can then, again, move forward, such as many nursing professionals, move forward in their career and not have to make such a tremendous choice, between my family or my children and my career. So I think there are a lot of things that we can do in that area in terms of supporting families. I think there's really a lot that we need to do because much of the research which we have does not even begin to touch the diverse family society here in the United States. Most of the research, once again, tends to be more based on Caucasians, women's, and traditional families, and that's not what the family looks like today. So we really need to expand those areas of research so that then we have firm evidence to support our policy. Legislators want to know, what does the evidence show? And so made great strides, but we've got really, I believe we have a long way to go yet.
Yeah, I could definitely agree. As a nursing mother myself, actually, this is very personal and to me as well, as far as being able to feel comfortable to incorporate this into the workplace, and I know it's part of the provision with healthcare reform, just allowing women to be able to do that. What are some recommendations you have for nurses to help push this along, or just allowing this to be a policy, or making it a policy, or getting policy makers informed, or having them informed?
Well, I think nursing needs to move forward as a profession. And that is, nurses really need to understand that their role does not end at the bedside. And many of the young women in the profession come in similar to yourself, saying, this is who I want, this is what I would like to be, this is how I can make an impact. But many young, not only women, but men, many young nurses, they come into the professional, they see themselves only at being at the bedside. They need to expand the possibilities for themselves. We address that very early on in the curriculum. We try and present, I believe, a pretty professional, expanded role of nurses and nursing, saying it doesn't stop with the patient or the client that you're caring for at that day, but they need to move forward so that what they're doing today can also have a larger impact on society in the future.
I also know that you've done several publications, and I know you've done many publications on QSIN and just as far as the transition of the nurse from RN to BSN. Can you talk a little bit more about that?
One of the things that originally drove me into nursing education was I believed I could have a greater impact on healthcare and society by then moving into this role of nurse educator. So that has always been an interest to me. Now, as we know, we then need to move nurses forward to assume a larger role within the healthcare system. For a number of years, I worked solely with RN to BSN students. And I realized after teaching in traditional undergraduate programs that this was a whole other ballgame. Very focused, very committed to nursing, and many of them had to give up a lot of their personal time and energy to then return to school. And I've learned to greatly admire and respect that group of nursing professionals, whether it be male or female, whoever it was, because they truly had a commitment to making nursing better for their clients. So that then drove a lot of individual study that I had on what works best in terms of working with this population, and how they respond to different teaching learning strategies than the typical college student would be. So I've worked with those students over the years, and again get tremendous satisfaction out of working with them. At the same time, in the past 10, 15 years, there's been a major movement with the Institute of Medicine publications in terms of what the expectations are for nursing practice and developing core competencies, the QSIN core competencies. And I've done some work in that area, once again looking at what is it that makes for a safe, competent nurse who can provide that quality patient-centered care based on evidence, the most current evidence. And so that then became a tremendous area of interest. So I've worked with faculty here to then take many of those QSIN core competencies and integrate them throughout the curriculum, undergraduate curriculum. I'm currently teaching a graduate course in nursing research, healthcare research, and I'm now moving forward to, again, working with other faculty to integrate those QSIN core competencies and to level them appropriately from undergraduate to master's and then doctoral level graduate students. With that, I realized nursing needs to get out of their silos. And nursing and many of the health professions do a wonderful job by themselves in this idyllic silo where they're only working with other health professionals such as themselves. And that led me to the area of interdisciplinary education. IPE, in terms of developing coursework where health professionals from other health disciplines, whether it be physical therapy, pharmacy, nursing, social work, nutritionists, occupational therapy, can actually, and physicians obviously, can actually gain a better understanding of what the role that each plays in terms of contributing to the overall quality of patient care. We need to do that together. We need to develop those relationships where we're all an equal partner with the patient in the center. We can't forget that patient is a key member of that healthcare team, where we all work together to develop some common goals, which is based on the evidence and which certainly values the patient's preferences, whether that be the individual patient, whether that be the family, or that be the community, and then certainly eventually, as wide space as global health.
Yeah. Oh, wow. That's great. You definitely sound as a visionary. You're definitely ahead of the 8 ball, especially with where healthcare reform is going. You mentioned the Institute of Medicine. They're definitely recommending nurses to reach their highest level of education. They're promoting safety as one of the aims. Definitely I mentioned buzzwords, just collaboration, interdisciplinary. So you're definitely ahead of what the IOM and other major nursing organizations are pushing for. And I guess I will end with this question. For someone like me, that's now like in my doctorate program, I'm definitely trying to elevate myself and help with just the field of nursing. Just any recommendations for me on how to almost kind of mimic and be like where you are as far as just being a visionary? I know some of it comes with just natural, just comes naturally, but just any tips for me as I soon start to transition from being a master's prepare to a doctorate prepare, and then going back into the real world again, as a new doctorally prepared nurse.
You need to continue to think of yourself like many other nursing professionals today, not only as a caregiver but as a leader.
Yes.
So when I saw this leadership project and liaison, you need to expand your view and your scope that you are a leader in healthcare, you are an advocate for your patient, you're an advocate for your nurses. So you need to be open to all the different kinds of things that you can do and set those high goals for yourself. set those intermediate goals of where would I like to be and what can I do now to move forward in that area. It really is up to you. It sounds very trite, but it really is true. It's up to you. It's up to you and your peers. You have the opportunity, with the things that are going on in healthcare today, you have the opportunity to have such a tremendous impact on nursing, on society, on healthcare. I want to move forward in that area. I think that's where we need to be. And I think you need to keep that truly as your focus and realize all of what you can do. And then I believe we can achieve it. So I'm passing the Olympic torch on to you, Blandine, and to your classmates and to other nursing professionals as yourself.
Oh, thank you. That's great advice. Definitely appreciate your time with talking to me today. I've learned a lot, and I'm definitely motivated, even more so. And so just thank you, and thank you for sharing your experience and just your advice. Your life is great advice, and so thank you for that.
Thank you very much. I've enjoyed our conversation today.
Okay.